Hey everybody, welcome back to the channel. Welcome back to Warland Tactical. Hope everyone is doing well. And for the first topic, congratulations, we got through 2020. Now we are in the second day of 2021 and I'm at work. But so are you because you're at work with me. What I'm working on is wrapping up and organizing my stuff from my normal job, which is Monday through Friday. I'm at my second job and out of break, so I figured I'd organize my kit. What we're going to do in this video is this stuff. First aid items. For you followers and subs that follow me and subscribe, periodically you guys will ask me to do a video. There is a much needed video I need to do that I was asked and requested to break down my trauma kit once again, and I'm going to do that. But in the meantime, enjoy the intro. Okay guys, welcome back. Here we are. I'm going to go ahead and throw you on my new mount, which is the GoPro chest mount. Super cool gift my wife got me. All right, here we go. We got all that cleared up and we're ready to get into this bag. Again, we are doing this video for a follower subscriber that requested to see the trauma bag a little bit more in detail. So Timmy hack that I'm using, obviously, you already know about it, but it's the SOTEC Go bag. As you can see, the coloration on this, I have used the hell out of it. No rips, no tears, no snags, nothing on this bag. It's been, we'll call it 6 years of service. Probably wouldn't hurt to throw this thing in the washer. But anyways, this is the transportation device that I'm using for my trauma bag that I keep in my vehicle. It has 3 exterior pouches. In the bottom pouch, part of my personal protective equipment, I carry a pair of Silenco hearing protection. You never know what environment you're going to be in. Got to protect your ears so you can focus. A few pairs of shoe covers. Pretty much you slip this over your shoe. Keep the contamination level down. I have a emergency bandage in here. A roll of Medi-Wrap. Three-tiered adhesive tape, waterproof, latex-free. I'm really super big on latex-free. You never know what the patient or whoever you're working on is allergic to. Top pouch, more PPE. We got a couple of high-vis mechanic gloves. These are just a pair of cotton warmer gloves that I would put underneath the nitrile gloves that I'm about to pull out. Here's a quick one-wave mouth breather. Other words, CPR mask. City of Hope hand sanitizer spray. Love these pens. Pause hand wipe. This is all my prep stuff before I get ready to touch somebody. We all seen these. N95 mask. More so the surgical mask. Amazing here. 3 standard. And I got a bunch of pairs of nitrile gloves, latex free. All right, that's everything in those. Turn this on its side. Unzip. Pull the storm flap out of the way. We have a few different sizes of air splints. There's a wrist, a thigh, and a leg, wrist, thigh, ankle air splint. And a surgical tube for a tourniquet. Okay, clear that out. Couple pairs of EMT shears, different sizes for different areas and different environments. Maybe you can't get these big ones into where you're trying to get into, so use the smaller ones. And again, we're on the side part of the Sotec bag. Two sections of MOLLE, so you can add various other pouches. And underneath the storm flap is 2 pockets. And it's stitched down the center to separate them. And again, YKK zipper, self-lubricating. Let's flip it over to the other side. Empty. And a quick waterproof emergency guide. Just in case I'm not coherent and somebody, maybe a bystander's there, and they need to take my bag and work on me, they can have their information on the spot. It's good to help in a duress situation. All right, here's the back panel. Has a teardrop design shoulder strap with a quick release buckle to pull the shoulder strap tight to you. Also, if you want to connect it over your headrest or your oh shit handle on the ceiling. All right, let's take a quick step into one of my vehicles so I can show you some mounting options. All right, so here's the top of the strap. Now, this is just some stuff I came up with. Not saying you have to do this, but you can mount to the back of your headrest, like so. Unclip that. I just try to utilize everything on the backpack when I find it. I just think out of the box, come up with ideas. I'll scoot over here so you can see that. There you go. You can dangle it from the oh shit handle or the rollover handle. You can do that as well. 2-inch buckle release on here. That way you can release it and pull the strap out of the way to get into the contents if you need to, depending on how you have the bag set up. Padded back panel. Dual zippers. Has a pull Velcro release right here. So you can either pull the Velcro or put your hand right here and do this motion to open up the interior. Let's push this up a little bit. Here's the Maxpedition. Here's the Maxpedition fatty pouch. We'll get into that in a second. Actually, let's get into that right now. So on the front, there's an elastic keeper. I have a tick puller and a splint out. I keep my splint outs right there. What that is, I'm not going to open it because I only have a few left. I got to upgrade. I got to buy some more. Anyways, it's a piece of metal. Screw it. You guys are worth it. That one's already open. Just kidding. So once you tear the package, you're going to see this little thing in here. It has a point right here. You can use this to scrape wherever your splinter is. Poke that to extract it. And that is the splint out. So this is contaminated. I touched it, so we're going to go ahead and toss that in the trash. Okay, open this up. Quick access to sling and some gauze for exterior wrapping only, not to a wound. That's what I use that for. Hospital surgical tape. Love this stuff because you can tear apart any size you want. Disposable syringe. You can actually reuse these, but they get gunked up. So these are for wound cleaning, whatever else you might want to clean. That way it gives you a bit more of a pressure, high pressure when you're putting your solution in there, which we're going to go over that in a second. couple packs of expandable gauze, 3-inch gauze roll, a conforming bandage, meds, here's some tummy tabs, emergency blanket, Dayquil. I carry Dayquil because maybe I'm not feeling right, and it's a caffeine pill, so I'll pop that in case I'm in a situation where maybe I didn't get to eat food and there's somebody that's hurt and I need to be on point, so I'll pop one of these. These are cut down SAM splints for fingers. Blood stopper bandage. It's a 2x2. What you do is you have a wound, put this on there, hold it there. It coagulates the blood. More tummy tabs. Those are more for me, not for the patient. And again, this is for exterior only. This does not go on the wound. So when I pack it with the gauze, I'm going to use this to wrap it. Some duct tape. Pair of nitrile gloves. I'm going to set those aside. I don't like things that are not in Ziploc bags, cross-contamination. Even though I know those are clean. These are some cut-resistant ones, by the way. But anyways, even though I know these are clean, I might take these out. Earplugs. Those are backups to my hearing protection. Toenail clippers. So if you have a hangnail, whatever else, if you need to cut maybe a piece of thread, well, if you're doing some stitching, if that is in your scope of practice. And again, this bag is built around my knowledge and my hands-on experience. This is not a kit for everybody. I was asked to show my trauma kit or my vehicle medic kit, and this is what it is. These are mini X-Acto blades. Let's go ahead and stuff this back in there. Actually, I need that. All right, as I'm putting this away, guys, this, again, I can pull this kit out and do a lot with it. This is mainly my tools and a bit of extra supplies. Right here, we have lots of tools. You have an eye extraction tool, which you open this up. That's a magnet. If you get a piece of metal splinter in your eye, I'm a construction worker, so that's a great tool to have. Here's the debris extractor, sorry. Couple X-Actos. If you can tell, it was kind of burnt. It's part of the sterilization. I do have a lighter hanging out in here somewhere. Forceps, different sets of tweezers. Love these scissors. These are bandage scissors. I actually like these a lot. They're great for cutting clothing. I mean, EMT shears, they're okay. I mean, these are actually a really nice pair. But you'll get some of those off-brand ones and they don't cut very well. But bandage scissors are the way to go. Let's see what else we got. Rat tourniquet. Hemorrhoid cream. I have some issues. Bunch of dental gauze. And you remember, those who go to the doctors and dentists, feel free to ask them. They will give you stuff. That's why I have these. You never know if you come into somebody and maybe got in a fight, has a broken jaw, and you feel like treating them. That will take care of that. And again, I have this kit. The reason why I carry all this stuff, I'm not a first responder right now. I've been a first responder. I am a volunteer disaster responder. But I care about people, so I built this kit around my skills, and I help people all the time. Anyone needs help, I'm here. Oh, look at that. Forgot a couple items. I love these Maxpedition fatty pouches. You can just stuff the hell out of them. All right, we'll set that to the side. Before we get into this, I have another set of gloves. These are by Ringers. You can see how they're padded, leather palm. Love these. These are great for working for extrication, meaning vehicles. That's what the high vis are for as well. I would like to get the armored ones, but this is what I have for now. For larger wounds, body wounds, leg wounds, impaled wounds, I have 10x30 trauma dressings. And here is a sand splint. Those of you that don't know what it is, if you can see that, sand splints are a conforming splint that you can bend, and it's pliable to any extremity you have. Neck, arm, elbow, foot, ankle, leg. There you go. I'll give you a shot at the inside of the bag. There's a sleeve in here for a water bladder or whatever. I keep a stethoscope in there. I do not have a blood pressure cuff because I'm not trying to take vitals. I just have that to hear for heartbeat. Again, I'm not an EMT right now or anything like that. I am just a citizen with skills. Here's my tool roll. We have all kinds of gauze. This is similar to your North American Rescue emergency gauze. It's not that brand, but I've used a ton of this. I have a ton of it, as you can tell. This is for major wounds. You open this up, and if you have a head wound, leg wound, whatever it is, you can wrap this thing and pack the gauze. Right here, I carry non-stick adhesive tabs. Oh, I'm sorry, non-stick pad with adhesive tabs. So basically what this does is it sticks like this, does not stick in the center. So if you have a burn, which I have some burn gel in here, right here. So if you have a burn, apply the burn gel, put the non-stick pad over there. As long as it does not stick to the burned area, these will work great. That way you don't pull the skin away from the burn. These should be 2x2s. Bunch more gauze for gauze packing. I will gauze pack before I use a tourniquet. I have tourniquets. I have SWAT tees. You don't see them in the kit. Two things, because this is set up to transport, because I'm already going to call 911, and then I'm going to work on the patient if I can. And if they allow me to. Remember, you got to get their consent. So back to that, I'm not going to strap my tourniquet on it. Well, I have a tourniquet. It's just, I like to wound pack. It's a lot easier. It's a lot easier for the technician or the tachnician to come in and to grab the patient. These are 5x9 pads, more gauze. Got a bunch of those. And in my vehicle, this section, I have a package about that big, which duplicates this and maybe quadruplicates this. So I have extra items. Let's move over here. We have a hand warmer and another emergency blanket. Just ignore that. That is a Benadryl syringe. I'm allergic to poison oak, so if I come into something gnarly, that's what that is. So anyways, this in here above that is a surgical mask. Actually, a few of them. I don't use these to put on my face. I use these to set on the patient and to set my tools on to keep everything nice and clean. I got a bit of medical tape on this. This is for CPR prep or AED prep, sorry, in case someone's hairy, shave them to get ready for the pads. There's a bunch more emergency blankets to treat for shock. We have a hand sanitizer pen, sprays, Afterbite sting eraser, In a pinch, I will use this. So I have a few tubes of super glue, some more tubby tabs. Those don't really go in there. And again, the meds in here are for myself, not for the patient. Tummy tabs are for myself. So here's some hand wipes. Basically just cleansing wipes to clean your hands before you put your gloves on. Or after. All about the personal, or PP&E, personal protective equipment. Burn gel. I have more of this stuff. I actually used some of it the other day, so I need to put stuff back in. Here's a bite stick. Here's a couple of face shields. Iodine swabs. And let's see what we got here. All right, so Timmy, what you want to do is go to Walmart and go get these 99-cent bottles. Whoever else is watching this, get the 99-cent bottles in the travel section. And I have one for alcohol and one for peroxide. The peroxide is actually for my pets in case they ingest something, it'll make them puke. The alcohol is to clean my utensils that are in the fatty pouch. I got a bunch of eye wash. As you can see, there's more eye wash over here and a spare syringe. This is for wound flushing and eye flushing. Back to this real quick. If you can tell, I mean, this is my own kit. I built all this. This doesn't come from somebody. This is my own setup. Everything that I have that is an item that will get cross-contaminated is in its own package. These are all sealed. Everything is up to date. These are 2022s. Everything is sealed, even the bite stick, as you can see. So that's just a pro tip. Make sure everything is sealed and separated from each other so you do not cross-contaminate your items. Now in my car, also, I mean, that is my trauma pack. You know, right now we have COVID scare and it's flu season, all that good stuff. So I have mad amounts of surgical masks, gloves. This is just a sample what's in my car. I have a lot of stuff. Here's a quick PP&E, gloves, mask, sanitizer gel, lens cleaning pad. One of my buddies gave me this actually. Works for Amazon, this is what they give out to their workers. Number one pro tip, keep a bottle of mouthwash in your car with antiseptic. Doesn't need to be expensive, just needs to have the antiseptic in there. So take a swig of this, spit it out, clean your mouth out before you're going to perform CPR or put on your mask. The reason why I say I'm using this is to kill any germs that I might contribute to the patient and to give myself an extra barrier between that and this mask. Or if it gets hairy, I'm going to use this mask. In my car, I have my other respirator as well. Not in my kit, I do have a roll of caution tape because you might want to zone off the area as well if you're going to keep your trauma kit in your car. So there's that. What else? I mean, this is my trauma kit, guys. Again, I did this video for a follower, so I can do a bit more of a breakdown of my kit for them. You can definitely go to MyMedic. I'll put the link down below. I got a 20% off coupon for them if you want. This is their standalone trauma kit. I mean, this thing's great too. It's opened up. It's filled. I've already gone over the contents of this in another video. So you could pick up this if you want, or you can build your own like what I did. And the reason I choose this bag, guys, by the way, is because the reason why I don't choose a box or a waterproof box or something for a car, you would think, hey, I need something more durable. This pack is durable as hell, and it'll get me into confined spaces. Like if there's a car pinned against another car and I need to get in there to maybe treat for shock at least, I can pull this bag in, grab my gear, pull the bag into the car, hang it on the car, hang it on the mirror. That's what the strap's for. And pull this out, put it on the dash, and I have everything to go. Open the toolkit, bam. Everything is dialed in. Well, there you go, Timmy. I'm going to get back to work. Guys, I did this in between my shift. So that's that. And again, we're done with 2020. Let's grab 2021 by its balls and let's go for it. I got a lot of stuff working, a lot of new companies coming in, and some bigger news. If it happens, I'll let you guys know.